So Prashant, I would kind of turn to you because you are in a very, very critical sector today. It's the healthcare. It is the most disrupted sector. It is also the sector which we believe will get significant benefit because of AI, simply because the doctor or the nurses and ratio against the population is way, way behind some of the developed countries. So it's virtually impossible for us to produce so many physicians or produce so many hospitals or nurses and all that, even without COVID, right? COVID has probably only complicated the problem further, right? And AI is actually looked upon as a breakthrough technology to significantly take the healthcare to the masses in a very cost effective and also in a very, very efficient manner. So I would like to hear from you two parts. One is what is it that you are sensing and seeing now, and also if you can also touch upon the fact that some of the most personal and most sensitive data is in the healthcare sector. You are sharing all your details right from the date of birth. Date of birth is just the starting point. You just share everything about you, right? So if you can touch upon from the perspective of what are the benefits, use cases you're experiencing from your space, and secondly, how are we dealing with this concern about the data privacy?
Thank you very much, Sudipta. I think you're right. As far as AI is concerned, one of the sectors where AI can actually make a quantum impact clearly is healthcare. Let me step back and give you, a framework in which we've been thinking about AI and ML in healthcare. There are two broad buckets, right? Bucket number one is around automation, and bucket number two is around prediction. When you think of automation, this is more like the faster, better, cheaper mindset, right? Let me give you an example. An automation often is actually misunderstood for prediction, which it is not. An example would be saying, you have a chest x-ray. On the chest x-ray, there are these white dots. After looking at those white dots, AI says, hey, he's got pneumonia. That's not prediction. That's only classification. And in this faster, better, cheaper mindset, we've actually gone down the path of making sure that we go down wherever there is availability of data. So there is an availability bias. You're looking at solving those easy problems. Some of these problems don't even need solving. When you look at availability data, you look at bed monitors in the ICU, enough data. I gave you the example of X-rays, for example. So when you think of this, that essentially is the automation bucket. But the quantum impact is really going to be when you think of this in the predictive world, in the proactive world. We spoke, all of the esteemed panel members, just look at the swaths of data we've spoken about. Economic data, social data, data from behavioral patterns, social feeds, whatnot. But what about the underlying biological data? What about the epidemiological data? What about the data about that individual? We live in a world today where randomized controlled trials has 0 Indians, and evidence from those randomized controlled trials are even applied on us. How is that even relevant? So when you think of prediction, let me give you a couple of use cases. And at the end of the day, AI is only as good as the action it enables. So when you think of the predictive world, wouldn't it, and there's work that actually is being done. So I'm actually not talking about, sci-fi and way into the future. Can you actually identify high-risk patients from the next 12 months? And then the the highest impactable members or patients, you can actually start doing something proactively today. One great end use case. The second essentially would be saying, I know for a fact that there are some degenerative diseases. Say, for example, there's a knee replacement, hip replacement that actually needs to get done in 6 months, 12 months, 15 months from now. Can you actually now work today in identifying the high value providers? Not just about the fancy names, but someone who can actually deliver on the outcome, on the knees and the hips that need to get replaced. So these are the two broad buckets, one being automation, the other being prediction. I think all of this clearly works on the underlying data. And I think the algorithm always is as good as the data. And when you think of data in healthcare, you got to think about it in 3 different templates. But let's once again break it out into the quality of data and the quantity of data. The quantity of data, as long as you have, you know, two important elements there. One, in terms of how many patients do you have this data about, number one. But number two, it's important saying what is the timeline across which you have this data from these patients. If we have to predict, saying in the next 3 years, which patients will essentially have gastrointestinal bleeds, we can't really do any of this analysis if we don't have at least 3 years of historical data. So if you were to ask me, saying, Prashant, would you prefer 200 million, patient data sets, or would you want 20 million over 5 years? I'll take the latter any day. Because in any case, you will take a 10% subset and do the analysis. Not only that, look at the amount of variables that actually go in. What medicines do I take? What are my diagnostic results? Have I undergone a procedure? Which doctors do I go to? Do I have some genome typing done? Right? When you put all of these epidemiological data, the medical data about the individual, and throw in economic, social feeds, that now actually gives you visibility about not only the individual, but the underlying biology of the individual. And data, to be candid, has been, in healthcare, unfortunately, has been a laggard in the adoption of technology. We think of technology saying, badhiya CT, MRI machine hai, vagera, vagera, a lot of technology inside the hospital. But the work that we've been focused on, and I can tell you, it's been about 15 years in healthcare and health insurance for me. And a big challenge has been to migrate the exchange of data and information between hospitals on the one hand and insurance companies on the other, which has always been on faxes, moved to electronic faxes and emails, actually an online platform. And even today, less than 1 in 3 actually happens on the platform, and 1 in 3 probably is an aggressive estimate. So when you think of data sets, not only about hospitalization, but I spoke to you about diagnostics, consults, meds, there's a lot of work that actually needs to get done from the point of view of the data itself. So I spoke to you about the quantity of data. Now let's talk about the quality of data. When you think about the quality of data, and it's interesting for us to actually recognize that that needs to be twofold. One is, unfortunately, how much rigor is actually undertaken when you're capturing the data at the point of the incident happening. Most of us store data that's relevant for us. We don't really think saying how it could be relevant for, and for the larger ecosystem that I'm actually a part of. Insurance company will say whatever is relevant for me is from the point of view of processing the claim. The hospital says from the point of view of clinical. So we end up actually, so the rigor that is actually required to be able to capture as many essential items, because data importantly has to be thought of as saying, I may not have the use of it today, but I'm actually sowing the seed for the future. And when you think of individuals, our needs biologically are very different when we're in the 20s versus when in the 30s. So for example, if I'm in the 30s, I'm getting married, I got kids, I got vaccinations for the kids, I've got a C-section or a normal delivery. When I'm in the 40s, now I'm beginning to get afflicted with chronic condition diseases, diabetes, hypertension, whatnot. I'm in the 50s, now I'm actually thinking, say, hey, maybe it's time to get a cataract done, and I replaced, and he replaced, and he replaced. I'm just saying, God forbid, saying, I hope I don't have to fix my heart as well. So you think of the biological journey of the individual across a period of time is humongous, which means the quality of data is about the rigor in terms of capturing all of these data sets, one. And second is consistently doing it over a period of time. So when we talk about AI and ML, that's an algorithm, but you actually need quality data for the algorithm to perform to its fullest. And which I think is important. And to your point, I think you and I, in the world around us, like I said, there are terms and conditions that you and I sign up for, and we don't even know. But the fact of the matter is, we actually willingly selling some of our data in terms of behavioral patterns, social feeds, whatnot, because we want a service in exchange for it, a free service, a free access. Healthcare and medicine, on the other hand, I think it is important because, one, from the point of view of consent, what stops us from actually saying it is not only about consent at the time of, seeking data from you, but even consent from you at the point in time that we share your data, right? And let me give you, when we think of data, a very simplistic example, and actually ties itself with the end use case as well, which is a relevance. Relevant for insurers, not relevant for someone else. And I'll give you a brass tacks example. The example is white hair and heart attacks. right? Now, in the advancement of medicine, it's irrelevant. But when you think of insurance and there are like 1,000 people waiting in queue outside, I have to figure out how many of them have actually white hair, because that is directly proportional to the number of cardiac ailments that I may potentially see in the future. I've got to price that into my insurance. So what are we speaking about? Saying is it broadly thought in the format of automation and prediction? Yes. Do you actually have to recognize that data is at the center of it, and you got to look at longitudinal data across a quantitative size of data, but also rigor and consistency in how it's getting captured? The answer is yes. And last but not the least, when you think of, at the end of the day, while we give free data away for behavior, as far as behavior and social peace is concerned, I believe that the individual, when you can share your biological data in exchange, with your consent, of course, in exchange for you to be able to, for AI and ML and for organizations to help identify and stratify your risk early enough for you and the family, you'd be more than happily and willingly sharing this, saying, hey, listen, I want to be part of this, or even be part of randomized control trials so that it actually helps and benefits the Indian community at large. So I'm going to pause there, Sudipta, and you feel free to call out if there is a question that is not answered.
No, absolutely. So I think, Prashant, that's very well articulated in terms of the entire depth and breadth. And I particularly like the fact when you talk more about the wellness aspect of it, which has the predictive component that I am going to see what is going to happen in future, and hence I will take some proactive actions to prevent it from happening, which essentially means that I'm moving away from curative to a wellness paradigm. And that's where the predictive technology will become more and more relevant and important, in addition to the automation, which is also very important. So I think that's very relevant.